Hi, my name is Mike Cymbor with Nittany Eye Associates. I've been an optometrist at Nittany Eye for coming up on 25 years, which makes me feel much older than I should have to feel. So we're a large practice in State College, Pennsylvania. We are about 9 to 10 million in gross revenue per year. We have 5 offices, 12 optometrists, one ophthalmologist. So we are in the backyard of Penn State University, so Nittany Eye Associates, State College, Pennsylvania. Mm. Yeah, so without question, the biggest challenge that we've had as a practice, and this probably isn't unique just to our practice, this is probably across the board, is staffing. Pre-COVID, we have a lot of employees. Let me start off by saying that between our 5 offices, pre-COVID, we were at about 85 to 90 employees, and if we had more than 3 employees leave in a year, for us, that was a lot. And then COVID hit and everything changed. But in this past year, we had, and when I saw this number, it was completely sobering. We had about 1/3 of our staff leave in 2022. And when you have that much turnover, you are in this, adrenaline filled, just get me through the day mentality, because you're spending so much time not only trying to provide high quality patient care, but you're in this constant state of training and interviewing. And all these staff members who were usually devoted to upper level leadership, now they had to migrate into interviewing and reviewing resumes and doing this kind of full time. So it created a whole host of challenges that really trickled down through the whole system. Yeah, we realized, so the way that we addressed the whole staffing issue, we realized that our hiring system was fairly inefficient. We'd have one staff member kind of go through resumes, and then they would make a call, and then another, reach out to them, and then another staff member would then pick up the ball and try to schedule, maybe a Zoom meeting with them first, and then after that, another staff member would jump in and try to schedule a face-to-face, and then another staff. And so you can kind of see where I'm going with this, where we had all of these staff members, and each was kind of responsible for doing a certain thing. But the time delay between point A and point B, and point B and point C, it was weeks before we were going through this process. So it was really an inefficient system. So what we realized is, in today's market, where we have to hire more than we've ever did because we're losing more than we've ever did, we had to completely re-engineer our system and close the gaps between point A and point B. And so we kind of created a separate hiring team that was kind of their own department almost. And the 3 or 4 of those staff members would coordinate every step of the way. And they were having weekly, if not daily, meetings about, hey, what are you seeing in the resumes? Who's really, who's looking good? How can we get this person in more quickly? How are we going to deal with the fact that we have all these webinars scheduled and maybe half of them aren't even showing up for that? How do we, and then how do we attract people? Do we use Indeed? Do we use some of these other resources? Do we sponsor an Indeed? How is this all working? So they kind of became their own department. So we've never had the need to do that before, but we had to respond in a much more efficient manner, and that's been working very well, very well. Being able to get people in on a much quicker basis. It's essentially true. That's right. We didn't really ever need that before. We kind of did HR the way a lot of companies do, and that's kind of from the hip. But we realized we needed to take a much different, efficient and organized approach. Yeah, with all the challenges that 2022 produced, going through the metrics, one of the things that really stood out to us was the clinical revenue per exam. We know that with the graying of America and with the incidence of all the major eye diseases like cataracts, glaucoma, macular degeneration, diabetic retinopathy, they're all going through the roof. So we know we have to respond in a medical management mentality. We have to do it better than anyone else. And so we kind of built our whole clinical approach around that, as well as using a really effective screening wellness program with both OCT and OptoMap. And so we knew we were moving in this direction, and we were also getting much more involved in supplements, macular degeneration supplements. We're starting to get into diabetic retinopathy supplements and the like. And so we kind of instinctively knew in the past that our clinical revenue per exam was high. In fact, according to Edge metrics, we had always been in the top 25%, across the country, and so we were always proud of that. However, in 2022, recently we realized we increased our clinical revenue per exam over $10 per patient. And so for us, that was really moving the needle. So it felt good to kind of see that and to see that we were moving in the right direction clinically and responding appropriately so we could manage more disease, leading to enhanced patient outcomes. Yeah, I think that one of the main strategies was all continually tweaking the wellness program, and so always making sure our technicians are using the right verbiage. Hey, Dr. Cymbor, you're a new patient. Dr. Cymbor would really like to have an OCT and an OptoMap on you as a new patient. And yeah, it's going to cost X amount, but it's going to benefit you as a patient in the long run. So continually working on that. The second big success that we had was we brought in a new electroretinogram unit, and we're using it more for glaucoma, but in particular diabetic retinopathy. So it really enhanced our understanding of diabetic retinopathy, the functional aspect of diabetic retinopathy. And so that instrument kind of came in and really allowed us to take the next step as it relates to both diabetic retinopathy and glaucoma. So bringing in, constantly evaluating and bringing in new technology for the benefit of our patients. Yeah, I mean, in terms of profitability, it was huge, and so and it's not without challenges. Meaning, if we look at the clinical and the optical in 2022, again, our biggest success was our clinical revenue really increased, but at the same time, our challenges was that the optical revenue decreased, and that's either a natural migration or it means that we have some challenges to overcome. So why can't we have both? But in terms of overall profitability, it paid huge rewards to us, and it allowed us to increase overall gross revenue, even though our optical department was shrinking. So the number one thing that we want to focus on, because we realized that historically our optical capture rate was kind of roughly in the 45% range, and not for us that was decent. I think compared to some other practices that would be considered low. Maybe some other practices it would be considered high, but for us that was where we were historically. More recently, we're we're down in the 30s. In fact, in 2022, we were down to 32% year to date. So that's a big decline from 45% to 32%. And there's all kinds of reasons for that, including more attrition of opticians. It takes so long to train an optician from start, until the point where they can actually be comfortable in what they're doing, and give great patient care in the optical arena. And so it's not surprising that would decline. And also, there's so many other factors that go into optical capture rate. At one point in time, we had this great buzzer system where we would hit the buzzer, the optician would come back to the room, and the doctor, we would explain, what the patient needs in front of the patient. And so that was working beautifully. But because of this emphasis on training, because this emphasis on hiring, we kind of got out of the habit a little bit, and we just kind of realized that more recently. So to respond to the challenge in 2023, we're kind of going back and re-engineering our whole optical program. We're kind of energizing our buzzer system. We're doing additional optician training. We are even doing some tech training, because a lot of times, sometimes patients are being walked back up to the front by a technician, and sometimes there is no optical handoff. That's with the technician instead, because they're available. So doing some additional tech training can make a big difference. So at least they can start having those conversations as they're walking them up to the optical area or checkout. So we're kind of re-engineering and kind of going back in and looking to see what works, and applying not only what's worked in the past, but some new ways of thinking to the whole optical process. So to my colleagues, I would say, we feel the pain, right? 2022 has been a tough year, but of all the professions that, all the healthcare professions that are out there, I believe optometry is poised to jump in and take the lead. And what I mean by that is that, across the board, when I try to make an appointment now with my primary care physician, I'm not getting callbacks. I can't get in to see them. No one's returning my messages. The medical system right now is a mess, and optometry is not immune to it. But we've always made our living on great patient service, and so that's what differentiates optometry from all the other healthcare professions. So I think we are poised to step in and continue to offer our patients the care they deserve, and even improve that in 2023. And so I'm really excited about the future, and I think we can do so many amazing things. And I believe that our profession, optometry, needs to continue to move towards the medical model. There's so many patients out there that need our care that aren't getting it. Patients with diabetic retinopathy who aren't having effective conversations with their endocrinologist or primary care providers, we could be having that. All of these patients with glaucoma who still do not understand exactly why they're taking medications or having laser procedures or surgical procedures, we can jump in and fill that gap. And macular degeneration, there's our patients are so afraid of that term, and the supplementation we can be doing in the earliest possible moment. Optometry has a big role to fill in 2023, and I think we're more than up for the challenge.